Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a great show planned for you. We have 3 exciting guests. Our first guest is Dr. William Futch of Novant Health Gastroenterology, Brunswick. And our second guest will be Debbie Lambert, and she's the Director of Clinical Excellence here at Novant Health Brunswick Medical Center. And lastly, we'll have Cindy Cheatham, who's the Program Director for the Novant Health Foundation here at Brunswick Medical Center. So stay tuned to learn about these valuable topics with HealthWatch. Now I'd like to introduce Dr. William Futch from Novant Health Gastroenterology, Brunswick. Thanks so much for being here today.
Well, thank you for having me.
Great. Well, I want to start this interview the way I start most of mine, and that's learning more about you. So tell me a little bit about your background and your education.
Well, I was born in Charlotte, North Carolina, and my parents soon after moved to Virginia and was raised in Virginia and did all my school training and graduate school, medical school, and my fellowship training in Virginia before I came home to North Carolina.
So you didn't go too far. You just went to Virginia.
Just up the road. My parents used to tell me that they taught them the 3 R's, reading, writing, and the road to Richmond, and now I'm back home.
Sometimes I ask folks that question, and they've been in like 10 different cities, and they've been all over, you know, with their training and what have you. So. I'm curious, what drew you to gastroenterology?
Well, when I was in graduate school, I did a lot of research in immunology and got very interested in inflammatory bowel disease when I was doing my research in a PhD program. And later went in to do my GI fellowship and came back to Medical College of Virginia, where I had been working on my graduate degree. And so kind of got pulled into gastroenterology that way.
Yeah, that's interesting. I know most people have a special interest or a focus in their specialty. Do you have one?
Well, I did advanced therapeutic endoscopy training, so my hepatobiliary disease is kind of, and liver disease ended up being my specialty, but you know, I really enjoy all aspects of gastroenterology. It's just a great field to be in.
Yeah, and it causes, so many people have tummy problems, and so we're always happy that you're there. And so I understand what you say when you say it's interesting, because it's just, there's a lot going on there. So when patients come to your office, what are some of the most common ailments or their common problems that they talk about?
And people, abdominal pain, diarrhea, nausea, heartburn, rectal bleeding, just about anything from your stomach down to the tail end of the gastrointestinal tract, if you want to refer to it that way.
Yeah, this is kind of a sensitive topic. Do you find that folks are hesitant to talk about some of these things?
I think that's one of the big problems when sometimes we see a delay in people seeking care, is because it's kind of personal and it's not bridge conversation, it's not church conversation, but when people actually get out and start talking about something like colonoscopy, they realize that half the people they talk to about it have already done it, but it's not something that people go out and say, oh yeah, I had my colonoscopy yesterday.
Yeah, I think that might be why some people put it off for so long, because they just don't want to talk about it. And you hear stories about how awful it is, and it's not. I've had one, and it's a piece of cake.
Yeah, and people not being open and discussing it, I think people who haven't gone through it, it kind of lets them, their anxiety and their thoughts in their mind, what it might be like, kind of prevents them sometimes from seeking the help they need.
I think so too. It's just one of those things you don't want to talk about. So,
well, we're here to talk about
We're here to talk about it today, right?
And
now they're going to feel better,
right.
And they're going to go out there and make their appointment for colonoscopy. I've had several, and I think it's the best thing you can do for yourself.
one of them.
Takes
Yeah.
care of you, for sure. I know you do a procedure called ERCP. I have no idea what that stands for, but I know that you have, and there's certain people who need that. Not everyone needs that. So tell me what that is and how that happens.
It stands for endoscopic retrograde cholangiopancreatography. I have a
Wow,
hard time
that is
saying
a mouthful.
Yeah, that's why everybody says ERCP. But the most common use of that procedure is for people who have gallstones, and one of the stones may come out of the gallbladder and become lodged in the bile duct, which drains the liver. And they'll develop acute abdominal pain, maybe turn yellow or jaundiced. Sometimes it'll cause pancreatitis. And sometimes when people have acute cholecystitis and have to have their gallbladder out and they have a stone in that duct, they may require an ERCP prior to getting their gallbladder out. So,
Oh, I see.
So it's not a procedure everybody needs like a colonoscopy,
Right.
but it's one that is very necessary in the right setting.
Is it a lengthy procedure?
No more so than a colonoscopy usually,
okay.
unless there's complicating factors. Yeah.
I know that you're interested in liver disease. Talk to me a little bit about that. How can you help those patients with liver disease?
Well, a lot of people with liver disease present the same, but there's multiple causes. So,
see.
One of the most common causes we're seeing now in the United States is something called fatty liver disease, or NASH syndrome, non-alcoholic steatohepatitis, which is caused predominantly by being overweight, and it's very common in type 2 diabetics. But it can end up over time resulting in cirrhosis of the liver just as much as alcohol or hepatitis can, so viral hepatitis. So, it's probably becoming the number 1 or 2 cause of
Really?
cirrhosis in the United States now.
Really? And so you do treat that type of liver disease, correct?
Right, we take care of that. People with hepatitis B, hepatitis C, we treat with antiviral medications now. A few years back when I first got into gastroenterology, there weren't really many good cures for hepatitis C. So now it's almost a 100% curable disease.
Really?
97% of people we treat now will get rid of it. So it's very, very rewarding to be able
Yeah,
to
I'm sure.
cure people now for it. And obviously the thing people think about when they think about liver disease, alcohol.
Right, that's the
then
first thing you
That's
think
one of
of.
the more challenging things to treat, because you got to convince patients that they also need to be a real active participant in curing
In their
that
care,
and help
yeah.
them get ready. So,
Yeah, that's true.
so.
Well, we're going to talk a little bit about that dreaded thing, the colonoscopy now. I know there's a certain age, and I think there's been some change to that age here recently. So let's talk a little bit about that. What is the latest guidance for that?
The new recommendations are that for all comers, we start doing screening colonoscopies at age 45.
That's with no problems. Just once you hit 45, you need to have a colonoscopy.
By screening colonoscopy, we're looking for people have normal bowel habits, no blood in their stool, they're feeling great and they're healthy. And the idea of that is to do early intervention and keep them that way. For patients that have family history of colon cancer, we're recommending they get their first colonoscopy around age 40 now. And in the old recommendations, we started that at age 50. So.
Yeah, and they really don't take very long, and the prep is not that bad anymore. I know.
No.
Early on, it was probably not the most comfortable, but they've made improvements.
In the early days, it was you may have heard some nightmare stories about the prep, and people weren't able to drink it. It was a gallon of some horrible salt water, and I used to tell people it tasted like river water. But the volume is less now, and we've managed to make it taste a lot better.
It comes in flavors.
Yeah, the down. I mean, it's still.
It's not great, but
still,
it's.
You need to get a DVD and be able to pause it, because you're going to go back and forth to the bathroom for the evening. But
That's for sure.
But you don't want to bowel prep on the Super Bowl. So.
No, absolutely not. And they don't take very long. They take.
A normal colonoscopy takes maybe 20, 30 minutes, and then a little bit of recovery time from the anesthesia, and you go home and eat breakfast.
Yeah,
even,
and
so.
they're not painful, and you don't remember anything. That's the best part.
Yeah,
You remember nothing.
The anesthesia has improved over the years too, and patients almost everybody, I tell them all the time, you're going to wake up with a big smile on your face.
That's right, and you're going to be hungry.
And I'm, and patients always smiling when I walk back in the room. And then people getting it for the first time are just so relieved and relaxed, and they just say, I just can't believe how bad I've made this in my mind, and now I realize how easy it is. And the good news about that is that they'll come back and do it another time because they realize it wasn't as bad.
Yeah, right. I do see an ad on TV where you get it in the mail, the kit, and then you take your own sample and send that back. Are those of value? How do you?
Yeah, the Cologuard is an alternative to colonoscopy for patients at high risk, patients that have had colon polyps before, patients who have family histories of colon cancer and first-degree relatives. I think that they probably should still have colonoscopies.
So that is the
goal. And not a Cologuard. But for that patient that, regardless of their risk, just refuses to do a colonoscopy, then the Cologuard's a good test. If the Cologuard's positive, then the next step is a colonoscopy. So, for patients who say they're never going to have a colonoscopy, I'm not sure the benefit of a positive Cologuard. If they've got to be willing to say, if it is positive, then I'll have a colonoscopy.
Well, that's all great information. It's been a pleasure having you on the show, and I look forward to having you back soon to talk about something as important as colonoscopies.
Great, thank you. I'll be glad to come back.
Thanks for being here.
Enjoyed it.
I'd like to introduce to you Debbie Lambert, the Director of Clinical Excellence at Novant Health Brunswick Medical Center. Thanks so much for being here today, Debbie.
Thank you, June, for having me. I'm glad to be here.
Good. I like to start out my show by learning more about my guests. So tell me a little bit about your education and your background.
So I am a nurse by trade. I have 37 years of healthcare experience, 27 of those being a nurse. The first 10 years I was a respiratory therapist. So started out my career early.
When you were 12, right?
Yeah, no, 19. So, but my background is mainly critical care nursing and stroke care is where my expertise lies. And I have a bachelor's and a master's degree in nursing, and my master's is also within healthcare leadership.
You've been a nurse manager too, right?
Yes, I have been a nurse manager for, I think I did that for about 19 years.
Wow.
So I have, leadership was, really my focus.
Right, yeah. So with all that background in bedside nursing, and then you were a nurse manager here at Novant Health for quite a while. So why did you decide to switch to your current role? What about clinical excellence drew you to that?
Well, the quality and safety of patient care. Being a nurse, you want to make sure that you are giving medications correctly, that you are following all the standards that you know that you have to make sure there's no poor patient outcomes. So I really was drawn to looking at, high quality, safe care and what all that encompasses.
Yeah. Well, so your big goal is just to make it safer for all of our patients.
Absolutely.
Is that your number one goal?
Absolutely. And so the role that I have now does focus higher level quality and safety. Healthcare has many regulations that are set forth from the Center of Medicaid and Medicare services and Joint Commission. So there are,
There's
regulations that we have to follow. And so they're set in place to keep our patients safe. And so that's what I get to do is I get to look at the bigger picture.
So how do you do that? What's your day look like?
Oh, very interesting.
You look at charts a lot, don't you?
A lot of charts, working with different department managers on process improvements, things that they may see in their area they have some opportunity in. It's a wide variety. You know, we look at readmissions of our patients. Every patient that's readmitted within 30 days, we're looking at that to see, did we have an opportunity, you know, and getting the right resources, why they had to come back, length of stays, you know, because there's a lot of
Yeah, there's a lot
of
goes into
standards
that, huh?
around
Yeah.
taking care of these patients.
Well, I know that we participate in Leapfrog, and so I don't know if anybody out there knows about that. So tell me what Leapfrog is.
Leapfrog is kind of like, it's your scorecard. Like
Okay.
if you were in school and you get scored in certain areas, and it's a quality scorecard. They give you a hospital safety grade, and I'm proud to say that we're an A, and we have been an A for several years now in a row. So that really means that what we're doing, we're really doing it the right way, and we're using our best practices. And, you know, we benchmark against other facilities and look at, you
Right.
know, who's doing it this way or that way so that we can make sure that we're improving.
So we're an A, and we've been an A for a long time.
Yes.
And I know an important safety metric is hand washing. And I think there's something new out there that monitors hand washing. So
Yes.
tell me about that.
So the system that we have is called SwipeSense.
Swipe
and
Sense.
it's a sensor technology. It's in the cloud. You know, the cloud is the big technology now that
Right.
people are using. And it actually, each person has one with their badge. It's a little tile that's connected to their badge.
Oh, okay.
And so when they go to enter a room or come out of a room, the foaming hand washing
Right.
systems have a sensor. So it's picking up that you have foamed in, and then as you come out, foamed out. The sensors are set up as I believe through the Wi-Fi system connection.
sure.
So it's
So it
very
records
high
you
tech.
every time somebody foams
Yes.
their hands at the dispenser and foams in and foams out, it records that.
It
And so
does.
as that's part of your job, you monitor those swipes.
We
right?
monitor those. The managers can see down to the person who's responsible for that, and it's an accountability piece,
Right.
and it's a responsibility. And
Yeah.
you know, we know that hand hygiene is the best way to keep infections down.
Right.
You know, even at home, it's
Right.
good to have that practice.
So part of your job is to read the surveys that we do, that patients fill out. Is that correct?
Yes, our patient experience surveys, yes. We get those through a third party. It's not a Novant company that does the surveys. We get the results and comments, and we take the good and the bad, and we use those to improve our processes.
Oh, that makes sense. So you do track patient satisfaction, and that's how you
Absolutely,
do that.
Yes.
And I laugh when you said you track the good and the bad, because that's how you learn.
Yes,
If people are honest and tell us exactly what they experienced or felt,
Yes,
then you can take steps to correct that.
absolutely.
Yeah.
Absolutely.
Well, I think without you, you could be a really sick hospital if we didn't have people like you.
Yes, and it's a big team. It's
Quite a big team.
part of a bigger
Right.
system.
And every hospital, every Novant facility has this
quality
position.
directors, safety directors,
Yeah, great.
and nurse analysts who are behind the scenes,
Right.
drilling into the charts and keeping us abreast of what's going on.
Yeah. Well, that's a very interesting job, and I really appreciate you coming on to tell us about it. And I hope that once this COVID's all over, you'll come back and tell us how we did through this whole thing.
I would love to.
All right. Thanks again for being here today.
Thank you.
Now, let's welcome Cindy Cheatham, the Development Manager for the Novant Health Brunswick Medical Center Foundation. Thanks for coming today, Cindy. It's a pleasure to have you.
Thank you very much, Jen. Happy to be here.
You always talk about fun stuff. Well, tell me a little bit about your background. That's how I always start my shows. I want to learn
Sure.
about my people. So
Sure.
tell us a little bit about your background and what drew you to Novant Health.
Okay. Well, I have been with Novant Health Brunswick Medical Center Foundation for almost 5 years now.
Yeah.
Prior to that, I served on the foundation board.
Right.
And for about 10 years prior to that, I worked in nonprofit health care. And as far as what drew me to Novant, I always wanted to be a nurse. That was kind of my, I know, right? It is. My grandmother was a nurse, and I always wanted to be a nurse, and that was my track when I started college. And after my first semester of biology, I decided I needed another
for you, right?
another avenue. And so working in this part with philanthropy and fundraising within the healthcare sector, I'm able to help in a very meaningful way, but not cause anyone any harm.
Yeah. Well, tell me about the purpose of Novant Health Brunswick Medical Center Foundation.
Okay. Well, the purpose of our foundation is to connect our donors and engage our donors with different initiatives and programs that we have here at Novant Health, so we can save lives and improve our community. So that's our main focus.
That's your main focus. Yeah. And how about now you're collaborating with the New Hanover Regional Medical
Yes.
Center Foundation, correct?
Yes, and that has been an exciting collaboration.
Yeah.
So we're working together really more as a coastal market region
Right.
to expand services, and I'm very excited about working with New Hanover. We've worked on a couple of different initiatives, so I see great things coming in 2022 and beyond.
Yeah, I think it's good for both of us. I'm so glad that we're now one company.
I do,
And
me too.
we enhance one another.
That's right. I
Everybody
agree.
brings something great to the
That's right.
table. So, let's talk about some of your top fundraising
Okay.
initiatives.
Okay.
And I think you have several.
We do. One of our big initiatives right now is around behavioral health. And what's so fascinating and interesting about that program, we started working on this as an initiative pre-COVID, really not knowing how the community and really the world would be affected by what we're doing. But some of the things that we're doing locally here in Brunswick, we want to expand our emergency room space so that we have private space, 4 to 5 patient rooms that are for those behavioral health patients. And behavioral health could mean, you know, someone who is suffering with some type of mental issue. It could be an addiction issue. There's
Right.
just different things. But,
Right.
But that's one of the
And the emergency department, as it is, it's just not equipped
No.
to deal with behavioral health
No.
issues. And so by adding those private
Yes.
or private rooms, it'll be a better experience
I
for
think
those
so.
patients, especially if they have to stay too long.
That's right. That's
Yeah.
right.
And then you've got a breast health program, right?
We do. And that is just such important work. We have that program to help women who do not have insurance
Right.
or who are underinsured,
Underinsured,
yes,
yeah.
to pay for their mammograms. And I can tell you some of those funds were depleted during
I'm sure.
during 2020 because of COVID. We've got so many communities that actively engage in fundraising for us for that, and they weren't able to have their golf tournaments.
Yeah.
We have several other large grantors that were not able to fund anything for us, so that's a huge need. And but I think with the collaboration now with New Hanover,
that's
and as
true.
we're expanding in the coastal market and expanding our resources, I hope we'll be able to.
Yeah.
I know we'll be able to do more,
Yeah.
but that's a big initiative is to help with that.
And then there's the prescription assistance.
Yes.
I think that's amazing. I
It
love
is
that one.
amazing. It is amazing. And where I see that is when you have a patient that comes into the hospital and let's say they're being discharged,
Right.
but they can't see their primary physician for 1 to 2 weeks, but they need that medication coverage. That prescription assistance gives them a voucher so they can take that to the pharmacy and have their prescription until they see their primary. So that's a huge help, especially, you know, if transportation's an issue as
Right,
well.
it is. Yeah.
Exactly.
Before, when you would or discharge a patient and they couldn't get their medication, well, all that effort you put into making them better just kind of went down the drain because
Right.
then they couldn't get their prescriptions.
right.
And
That's
so
right.
this allows that to them to do
That's
that.
right.
So,
That's right.
well, those are all really important
Yes.
projects, and those are all focusing on our patients.
Yes.
So how about our team members? How can the foundation, or how does the foundation support our team members in times of distress?
Right. Well, we do have what we call an employee emergency fund.
Right.
But we kind of expanded that last year during the COVID crisis, or at the height of the COVID crisis, because we had so many of our team members that maybe their significant other lost employment,
Right.
or the children were sent home and they needed care, or they had to go to daycare and they needed funds to help them with that. So we were able to really help in that space. And then the employee emergency fund, I mean, I can think back to when we had Hurricane Florence, for example.
Yeah.
We've
had lots of things happen in terms of weather related and stuff where
Yes.
we've been able to help.
Right. And so we had team members that were, didn't have a home, or were put without their home when they're having their roof,
Right.
repaired and
Right.
whatnot. Or so it's a good thing.
Yeah.
It's important for us to take care of our
Right.
own.
I know that you've received a couple of grants. Let's talk a little bit about those.
Okay.
There was one, the Duke Endowment,
Yes.
and then the Golden Leaf.
I know. Golden Leaf Foundation, we received a grant for a water well. And
That's pretty cool.
I know, I thought it was really neat. We want to make sure that in a time of a hurricane or any other crisis that our water supply is not compromised, because we have to have that for our patients, right?
Right.
To stay open. So that is something that I'm very excited about, that, going into the hurricane
So it's
season.
right here on campus.
It's right here on campus. So I think it's ready to go. And
Let's hope we don't
operational.
have to use it, but
I know,
it's there
right?
if we
I'm
need
glad
it,
it's
right?
there. I'm glad it's there.
And then one of them was a telehealth or a telepsych
Yes.
program in the middle schools?
Yes, that was the Duke Endowment. That was part of our behavioral health initiative. One of the things that we wanted to do with that, we want to expand into the public schools. And our leaders in the public schools said, you know what, let's target the middle schools first.
Yeah.
And that's what we did. And again, this grant was written pre-COVID, not knowing that when the children re-entered,
Now they really need it.
they do, back into the school system,
Yeah.
what would be needed. And one of the things that recently they gave us kind of a touch base on how the first 30 days has gone is they have already taken care of students in all 5 middle schools.
That's awesome.
And
And what better place to start
Right.
than in the school system?
that's right. And we've been able to avert some emergency room visits by doing those telehealth and telepsych visits. So
That's
it's
awesome.
been a real positive.
Well, before we wrap up, I know it's getting close. It is the end of the year,
Yes.
and oftentimes people are looking for areas to make last-minute donations to,
Yes.
or things like that. So, is there a method by which people can make a
Sure.
donation to the foundation?
Absolutely. They can go online, www.supportnovonthealth.org, and you can, of course, look at the different programs that Brunswick has. You can always mail in a donation, but as people are making their year-end donations, we would love to be one of their 3 charities of choice.
Oh, that's awesome. Gosh, that's awesome. Well, Cindy, it's been a pleasure to have you. Thank you so much
you.
for coming.
Thank
and
you.
I look forward to having you back and talk about some of your other successes
Absolutely.
at the foundation.
Absolutely. Thank you.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope you found this information to be helpful and beneficial to your family. For more information on Novant Health and the services offered, visit our website at novanthealth.org. Until next time, be safe, and thanks again for joining us today on Health Watch.
The internet just got an upgrade. 1 gig internet is being hailed as a tipping point, revolutionary, and a game changer. No, not that game. This game. The critics are going all in on 1 gig internet. Push your internet to the limit, then rake in the rewards. Get blazing fast speed up to 1 gigabit per second from ATMC, the area's broadband leader. Call 910-755-8059 today.
So my owner tells me he's getting a home security system from ATMC Security. Naturally, I remind him that he already has the services of a trained security professional. He just pats me on the head and says, ATMC Security monitors against burglary, smoke, fire, and carbon monoxide. And you can get it all for as low as $17.95 a month. That's less than a bag of dog food. How am I supposed to compete? Maybe if I growl at the installation guy, he'll just go away.
ATMC Security. Peace of mind you can afford.